All right, ladies and gentlemen, it is 10 a.m. Let's not delay all the fun that we want to have this morning. So let's get right into it. I'm going to call to order the regular meeting for the Washoe County Board of County Commissioners for September 21st, 2021. And with that, I would ask Mr. Adam Hines, you are here in the public with us. Would you please lead us in the Pledge of Allegiance, sir? Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, Mr. Hines. Appreciate that. It's always nice to see you. All right, Madam Clerk, can I get a roll call?
Bob Lucy, Chair.
Here.
Vaughn Hartung, Vice Chair.
Online.
Alexis Hill. Here. Kitty Jung.
Present on the phone.
Jeannie Herman.
Here.
County Manager Eric Brown.
Here.
Deputy District Attorney Mary Canderas. Here. And I'm Jan Galasini, your County Clerk. Sir, you have a quorum.
Thank you, Madam Clerk. Do appreciate that. Mr. Manager, that takes us into item 3.
Item 3 is an appearance by Washoe County Recorder Kale Work to provide an update on the Recorder's Office innovations. She's in chambers with us this morning.
Good morning, Madam Clerk. Recorder. It's nice to see you.
Good morning, Mr. Chairman and Washoe County Commissioners. Kaylee Work for the record, Washoe County Recorder. All right, let's see. Fantastic, thank you so much for having me today. As you know, our office is dedicated to preserving and recording and permanently preserving records that have to deal with real estate, anything property related, marriage related, as well as other legal and financing documents. Today I'm going to share our newest programs and initiatives, but I thought I'd first cover off on our recent activity. There are 2 graphs on the slide. The one to the left highlights our month-over-month recordings. If you follow the yellow bars, you'll see what happened to us in 2020. Now this is a calendar look, January through December. You'll see where we slowed down in April of May last year, and then we had significant growth in our recordings throughout 2020 and into 2021, which you see in green. I wanted just to show and highlight how much activity we have been doing over the last 12 months. It's significantly higher than what we saw in the years that predated it. The chart to the right also highlights our copies, since we produce copies related to anything property related, and again, marriages. This chart on the right is highly influenced by, it could be employer benefits, DMV requirements with a real ID. Whenever someone needs to show proof of marriage or proof of name change, a marriage record is often that document that comes up. All right. So there are 3 primary programs I'd like to share and highlight with you today. These are innovative solutions that we have worked on to enhance the customer experience. The first is our new recording notification service that we call RNS. In January of this year, we announced a new recording notifications free to the public via our RNS solution. RNS is a subscriber-driven tool. Members of the public can sign up for the service free on our website or by scanning the QR code here. Last year, we processed over 180,000 records, and now subscribers can be alerted anytime a document is recorded with their specific property, name, or parcel number. A prime example of why this tool is useful is because many people are not checking their property records on a regular basis. So if a lien was placed on a property, a homeowner may not know about it for months, even years down the road when they go to sell, and it can become a tremendous headache for them, causing delays in that process. This project was also completed in collaboration with Clark County. Customers owning property in both Clark County and Washoe County can now have that same user experience by signing up free of charge for RNS. Our second big program is our large-scale digitization project. A few years ago, when I was elected Washoe County Recorder, a big nightmare of mine was what happens if this building catches on fire and we lose all these original documents in our library? Sure, we have backups on microfilm, but that quality degrades significantly over time. And so 2 years ago, with the support of this commission, we underwent this large digitization effort to bring our record-keeping systems updated and safely transfer those land records from physical books to digital images. Over the last 2 years, US Imaging brought specialized scanning equipment on site, bringing 1.4 million documents to digital form. Since then, they have also indexed our marriage records and performed rescans for optimum quality. This project should be exciting for historians because anyone interested in historical artifacts will now have access to these documents. And for our land records, that dates back to 1862. The final documents here will be uploaded into our document management system next month, and that'll make it very simple for the public to search and access those records, as well as our staff going to retrieve those to produce copies as well. So it saves us significant time and cost with producing those copies. All right, and third, this project actually predates me. It began in 2018 in partnership with a blockchain technology vendor, Titan Seal. As you know, anytime you've requested a copy of a certified government document before, it's typically come in paper form. I have a copy here of a marriage certificate. You'll see here how it has the embossed seal. We know that this is a true and authentic original certified copy of this marriage certificate from a government entity. What Titan Seal was able to do was reproduce that seal in digital form by using blockchain technology. And what used to take us 7 to 10 business days to mail a paper form like this now takes minutes because we can send it via email. Now, digital certified copies can be emailed and received just within a few short minutes, and it requires no special technology for that customer or the receiving entity who requires that document. All they need to do is be able to open up a PDF. This has shown highly effective with employers, with the Social Security Office, and even some DMVs. And we believe with the digital transformation that has happened during COVID will enable this technology to expand and have greater adoption in the future. So that brings me to a close. In the future, we are looking at a few other innovative projects. One is allowing and enabling electronic map recording. Also, Record at Home service is a growing service in the recording industry, as well expanding on a hybrid workspace for the office of the future. So now I will close and end with a few fun testimonials from the public, and I'll open up for any questions.
Thank you, Madam Recorder. What a wonderful presentation, and thank you for joining us this morning. I'm going to open it up to the commissioners for any questions that they may have in regards to the Recorder's Office. Commissioner Herman.
Thank you, Mr. Chair. I agree. It's a great presentation. It sounds like quite an advancement in our Recorder's Office. Good job. Thank you.
All right. Commissioner Hill.
This is a great update. Thank you so much. I think that you are making a lot of strides to digitize these documents and make the ease of not necessarily having to come into the county building a lot better. So the timing with COVID couldn't be better. So congratulations on that, and just keep us informed on how we can support you and ensuring that you're delivering the best service to our constituents.
Thank you.
All right. Commissioner Jung or Commissioner Hartung?
I have no questions, Mr. Chair. Thank you for the great presentation.
Ms. Work, through the chairman, I cannot tell you enough how much I admire and respect how you've taken this office and really brought us into the 21st century and beyond with the Bitcoin connection and your experience. And most importantly, our county recorder is a Harvard educated recorder. And while I don't think education is the be-all and get-all, and I think people can do plenty of things without credentials, I'm just so dang proud of you and that that you are using your expertise to make this community better in a position that I don't think has a lot of creativity, but you've blown my mind. It does, and I'm really glad to see what you've done, and especially the historical documents. That's something that is so important when it comes to not just people getting married, et cetera, but to have the archivist's ability to go back into history and find what has been at least recorded. So I thank you so much. And as the Commissioner Hill said, anytime you need any assistance from this board, please don't hesitate. Thank you, Mr. Chairman.
Thank you, Commissioner Jung. Ms. Work, it's been an honor to serve with you. You and I have traveled to DC quite a few times, and the innovative things that you have taken from your experience in Washington, DC, your experiences from Harvard, but I think to Commissioner Jung's point, it's not necessarily the education, it's the innovation and the entrepreneurial spirit that you bring forth to this position that makes a huge difference within that recorder's office. The blockchain technology that you've brought forth, and knowing it from a business standpoint, a recordation of deeds for real estate and all the real estate transactions that go on has always been a challenging issue within our community. People get frustrated if they're going to record on time and how that's going to work, and it's a major process. And through your office, I've heard consistently over the last 4 years how efficiently that has gone and how well that has taken place. And I think through your leadership and all the initial other initiatives that you've taken on to bring those to fruition in such a short period of time, I do commend you in your office. I think you've done a phenomenal job. It's a lot to undertake, and you've come through stunningly. So thank you so much for being here. But I do have one quick question for you. Talk about the record from home. I mean, that seems pretty challenging. How would that record from home initiative work?
Sure. One thing that we're seeing growing is the remote online notary. We've seen digital signatures and other documents that have been submitted for a number of years at this point. So with the growing electronic notary, digital signatures, all these things combined kind of lends itself to what does the future of recording look like. We've seen some counties who've offered kiosk services where they've put a kiosk in different parts of their counties to make it easier. And one thing I always think of Incline Village, right? Because those folks have to travel down the hill, even sometimes when the weather is bad. I think of Gerlach. So kiosk services sounds really like could work well here. But now we're seeing that these recording services vendors are taking it to the next level. What's after kiosk services? And so record from home is something that they're testing with smaller scale counties at this time. It seems to be going well. There's a rural county in Nevada who's already implemented this about a month ago, and they're testing it. And so this is something that we're looking at with our recording vendor to see if it makes sense for us in the future.
So how would that be impacted? I mean, and I've heard you speak on cybersecurity before. The cybersecurity issue, obviously that becomes a massive issue when you're doing recordation and qualification of documentation. How would that play into this?
Sure, that's a great question. One that we're still looking into from a securities component. I don't know how they're doing that with our recording software vendor today. It's something that we're just kind of scratching the surface and learning more about. So I hope to have answers to that soon.
Great, fantastic. Well, I look forward to those innovative services coming forward, and thank you for all you've done. I do appreciate it. I have no further questions, so thank you, madam. Have a wonderful day, and thanks for presenting today. All right, with that, we will move on to item 4. Mr. Manager.
Item 4 is an award presentation by Adam Heinz on behalf of the Academy of International Mobile Health Care Integration, affiliate of RIMSA, to Washoe County and Washoe County Health District, recognizing the COVID-19 community triage line. All right, Mr. Heinz is here this morning.
Welcome, Mr. Hines.
Thank you, Mr. Manager. Good morning, Mr. Chairman, members of the commission. It's my pleasure to be here. You know, usually you're taking time out of your day to recognize first responders, and it really is exciting to be able to recognize you today with this award. This award is on behalf of, as the manager said, the Academy of International Mobile in Healthcare Integration. REMSA is a member of AIM High, which represents high-performance emergency medical and mobile healthcare providers in the U.S. and abroad. Annually, AIM High celebrates and promotes high-performance, high-value EMS through its AIM High Excellence in EMS Integration Award. In the spirit of promoting true healthcare integration, nominees are primarily sought from agencies, organizations, municipal entities, and other healthcare providers outside of the AIM High membership. When the call for entries went out earlier this year, REMSA Health knew that Washoe County, the community triage line, would be an award-winning program. And we were right. I'll read from the nomination now. In March of 2020, as the COVID pandemic arrived in Northern Nevada, Washoe County municipal leaders identified the critical and immediate need to launch a resource that would connect residents to accurate information, providing answers to questions and triaging callers' concerns about COVID-19 symptoms. The county already had the 311 telephone line in place for residents seeking information about non-emergent government matters. However, that line was quickly overwhelmed and was not able to fully meet the needs. Recognizing REMSA Health's experience and expertise as an internationally accredited medical dispatch center, Washoe County and the Washoe County Health District asked REMSA to stand up a 24/7 call center for residents to have their symptoms triaged and to facilitate testing and contact tracing. The request came in on a Saturday, and by Thursday, just 5 days later, the triage line was staffed and active. Washoe County's community triage line mobilized across several departments at the two agencies, including information technology, who had to coordinate so that call center decision trees were accurate and that calls were transferred appropriately if necessary. Clinical and epidemiological staff from REMSA Health and the Washoe County Health District respectively worked together to develop meaningful questions and exposure symptoms, underlying health conditions, and whether the caller needed further patient guidance through REMSA's Nurse Health Line. Public information officers and Joint Information Center representatives worked with regional media as well as created owned content to promote the triage line as a central spot for people in our community to call to get information about COVID-19. Washoe County's community triage line is an outstanding example, taking more than 30,000 calls in that time, of how the industry-wide characteristics that EMS is known for can support municipalities and government agencies in the time of extraordinary need. Mobile healthcare is nimble, responds with intention, is a community safety net, and is able to provide care and resources in austere environments, including over the phone. EMS is a constant state of readiness and able to pivot. Expertise in emergency communications and training and mass events sets EMS providers from healthcare or other based organizations. All of us, coupled with the willingness of Washoe County's leadership to partner with a private organization to provide a solution in a time of crisis, is commended. Washoe County was focused on protecting their citizens, mitigating the possibility of overwhelming the regional healthcare system, and navigating callers to the right resource. In the midst of the global pandemic, Washoe County leaders doubled down on their value of quality public service. They placed the needs and expectations of the public at the center of the response. This validation that government bodies and private organizations that share a commitment to innovation and excellence can achieve improved public health outcomes. I'd like to take the opportunity to congratulate Washoe County on receiving this Excellence in EMS Integration Award from the Academy of International Mobile Healthcare Integration. I know that there are representatives from the Health District, the Triage Line, and the County Emergency Management Center that are here on behalf of that award, as well as you, and I appreciate all you did. So thank you.
Thank you, Mr. Hines. Do appreciate that. Mr. Manager, should we take a brief picture with Mr. Hines and the award?
Sure.
Let's do that. We'll come down here and take a quick picture. Mr. Hines, thank you very much for coming today and presenting us with that award. We do appreciate it. Thank you for all your work you guys do at REMSA as well. All right. With that, that takes us to our next item this morning, which would be item 5. This is public comment. So, Mr. Manager, will you please take us into public comment this morning?
Item 5 is public comment. Comment heard under this item will be limited to 3 minutes per person and may pertain to matters both on and off the commission agenda. The commission will also hear public comment during individual action items with comment limited to 3 minutes per person. Comments are to be made to the commission as a whole.
All right, Madam Clerk, will you please call public comment?
First up, we have Patricia Artis, and I do have some handouts for her to be distributed.
Welcome, Ms. Artis.
Thank you. I am Patricia Artis, President of the Board of Directors of Menai Village. I am also a foster parent in Washoe County who has provided a home for more than 100 children ages 3 to 18 for the last 35 years. I've witnessed the struggles of kids aging out of the foster care system unprepared for the challenges of living independently. How many of us were ready at 18 to go it on our own? Menai Village is a nonprofit organization whose mission is to help break the cycle of homelessness by providing a supportive housing program to ensure the successful transition to independent living. Washoe County mirrors these painful national statistics. Youth aging out of the foster care system comprise approximately 50% of the homeless population. 65% of them are in immediate need of housing. Within a year, approximately 46% of them will have had contact with the criminal justice system or been incarcerated. Within 18 months of leaving the foster care system, 40 to 50% become homeless, even if they started out with an alternative living arrangement. We believe these are unacceptable truths for the youth who are our future. When the immediate need for a safe, affordable place to live is no longer an all-consuming, stress-inducing issue, these young people will be less vulnerable. They will be able to focus on acquiring the skills necessary to live successful, independent, and stable lives, the ultimate goal being that they become contributing members of our community. Menai Village seeks to provide the connection and support that has been missing in the lives of these young people due to the loss of vital familial connections inherent in the foster care system. A study conducted by Annie E. Casey Foundation in 2016 found these trends in the United States. Half of the older teens who left foster care aged out rather than reuniting or connecting with a family. Half have experienced 3 or more foster care placements, sometimes as many as 16. A third experienced a group home or institutional placement during their most recent time in foster care. Less than a quarter of the young people who received federally funded transition services received services for employment, education, or housing. Our objective is to provide individual living accommodations for each young adult for which they will pay rent and utilities. Individual living spaces are imperative in order to break the cycle of group home living that has been a significant part of their life experience. It fosters a sense of pride, ownership, and responsibility. They have the opportunity to create a home, perhaps for the first time, and write their future story. We are asking for help in identifying and acquiring funding to build Menai Village. I invite the opportunity to meet with interested council members and present further details at another time. Thank you.
Next up, we have Tracy Thomas, and she also has a handout to be distributed.
Okay. Thank you, Ms. Hurd. Thank you. Welcome, Ms. Thomas. Can we have the overhead, please?
Good morning. Psalms 1:1 teaches us, "Blessed is the man who does not walk in the counsel of the wicked, or stand in the way of sinners, or sit in the seat of mockers." Last week, Mr. Solaro mocked any and all public comment related to COVID, despite possessing no medical license, certification, or professional expertise in the matter. Mr. Solaro also either has no knowledge of the therapeutics for COVID or is intentionally suppressing the information from the public, which qualifies as a wicked behavior. Mr. Solaro also neglects reporting what other countries and states are doing to address COVID. His presentation states the number one objective is to reduce the spread of COVID, and number two is to empower citizens and visitors to make informed decisions. Yet he fails both objectives by omitting therapeutics. He suggests public comment is not a location to get information or make decisions. I then ask where Mr. Solaro suggests we find the treatment information he is neglecting to provide. Apparently, sewer data is more important than data on patients receiving therapeutics and therefore reducing the number of hospitalizations. Nor do his statistics provide the number of cases that are repeat infections or repeat tests, and how many of those are non-citizens. It is not a coincidence your surge corresponds to the hemorrhage of COVID-positive migrants transported to Reno from the southern border. Yes, they are here by the hundreds. He directs the public to wear masks so the numbers will go down, while there is no evidence that masks make any impact on the numbers. Safe distances and temperature checks do. Why did temperature checks stop? So for yours and Mr. Solaro's information, I am providing you authentic facts from certified physicians and the links for you to research them yourself. Dr. Peter McCullough, Texas is listening to him and have mandated doctors must provide information on treatment to anyone who is tested positive for COVID. COVID is a treatable disease. It is not going away. Treatments can reduce the number of patients going to hospitals by 85%. It has been proved. Why isn't Washoe County mandating this information? If Mr. Solaro had met his objective, 85% of our hospital beds could be available now for his car accident. Dr. Li Ming Yang, firsthand knowledge about COVID and CDC's efforts to try to cover it up. The Israel study proved natural immunity from contracting COVID is longer lasting protection against the Delta variant than inoculations. America's frontline doctors provide therapeutics Washoe County won't.
Thank you, Ms. Thomas.
Next up, we have Aaron Massengale. Thank you.
Good morning.
Ms. Massengale.
I would like to request that we agendize and pass a resolution to end the public health emergency and to ban vaccine passports and any sort of vaccine verification system that creates a two-class system in our modern-day society. Anything other than that is promoting modern-day segregation. Imagine it's 1981, and we asked the LGBTQ community to provide verification of whether they had AIDS or HIV. Thank you.
Thank you, ma'am.
Melanie Sutton.
Welcome, Ms.
Good
Sutton.
morning. I'd also like to request an end to the public health emergency. So in Vegas, about 20% of the COVID deaths were fully vaccinated. And there's an article probably should have printed for you. There's also, people are dying from the vaccine. People are spreading the virus through the vaccine. And so I don't understand why people are continuing this. There's like almost 15,000 people that have died just from the vaccine. If this was a trial, which it is, but they would stop this vaccine after one death. And then all the premature births from people wearing masks because their baby's not getting the oxygen for their vital organs to be growing. So yes, we would like to ask for the end to the public health emergency.
Thank you, Ms. Sutton.
I also have an email from Mark Nelson and one from Janet Butcher that will be placed on the record. And that is all the public comment.
Thank you, Madam Clerk. Seeing no further public comment, we'll close public comment and bring it back to the board. Mr. Manager, we're on to item 6. This is Commissioners and County Managers' announcements. Mr. Manager, do you have anything this morning that you'd like to kick us off with?
Yes, Mr. Chair, I have a couple of items. Number one, as I mentioned in my comments last week, the county, effective yesterday, did make the transition to the .gov domain name. So from this point forward, all email addresses, websites, and so forth will transition from .us to .gov. Again, this was an important change we felt to increase the level of security that the county's online presence incurs. So the old email addresses and domain names with .us will continue to work, but moving forward, we will transition all our communications materials to .gov. So I wanted to acknowledge that. Second, the staff will be providing an ARPA update at our next meeting next week. As I think all of you know, we have been working internally to evaluate requests from Washoe County departments, and that process is moving along. We also have established a meeting with the state treasurer at the end of next week, so that we can compare notes on what the state's priorities are for its ARPA spending and make sure that the county and our region are working together to minimize redundancies and that kind of thing. So we'll have an update for you next week. That process continues, and I suspect, based on the timelines that we've seen from the state and from the Treasury, we will continue to take public input through the end of October or November. The last point is we're also planning to, in the next week or so, release information on redistricting maps. As you know, Mr. Chair, staff has been meeting with each of the commissioners individually to share an overview of the latest census release. We've gotten some valuable feedback from each of the commissioners, and so in the next few days, or by the end of the week, we hope to release the maps so that the public can begin to see what some of those options are, give an opportunity for public input, and my estimation is at our first meeting in October, we will come back for action by the Board of County Commissioners. It's important to note that the state has not set the dates yet for the special session to deal with redistricting, so we believe that that means there will be some change or lag in the timeline for implementation. We just don't know yet, and we continue to monitor that situation. Those are my updates, Mr. Chair.
All right, thank you, Mr. Manager, do appreciate that. Commissioners, anything first? Commissioner Herman, I have you signed in first.
Thank you, Mr. Chair. Tracy in the audience here brought us some pretty interesting information about alternate treatments for, and I would wonder if we could ask the health department or someone in the county that would be a responsible person to study some of this information and see if there isn't a possibility of using some of these options. Could I have a report on that in the near future? Maybe by the next meeting or as soon as possible? Thank you very much.
All right, thank you, Commissioner Herman. Commissioner Hill, I have you signed in next. Nothing? Okay. Commissioner Jung, do you have anything this morning?
I do, Mr. Chairman. I wanted to let the board know that, and I'm sure you'll speak more about this, but you and I did a quick run by the Reno National Air Races to say hello to somebody that you, Mr. Chairman, sponsored, which is VFW Post 9211, and their vending site in which they hand out poppies, right, for donations, and they sell some other memorabilia. And I have to tell you, so the public knows, that's when they're handing out poppies, that's their #1 fundraiser as an organization. And so I'm sure they will be coming back to us to let us know exactly how many funds they raised. But I thought that the air races were great. They were very well attended. It was outdoors. Everyone was masked. And we saw lots of families and children and kids on school buses coming in there. So that's really a great event in terms of family-friendly, outdoors, and, you know, another legacy event that we have here that makes us very unique. The other thing that I'll say that Commissioner Hill is too modest to repeat, we were at the Latino Heritage Month Festival on Wells, the Fiesta on Wells. And what's important for this commission to know that really made me feel so good is that there were 3 different booths giving COVID vaccinations. They were completely full, and I just wanted to say to the health district, I went by their booth specifically to tell them thank you. And truly, those were the heroes out there, not only receiving the vaccination, but also the people out there on their Sunday working for the health district, putting people in a safer position to not transmit the virus. So bravo to the health district on Sunday, and bravo to the 25% of our population in Washoe County to have their Heritage Month Fiesta on Wells. I thought it was just beautiful, very well attended, also very safe, outdoors, everyone masked. Thank you, Mr. Chairman.
Thank you, Commissioner Jung. Do appreciate that. Commissioner Hartung, do you have anything this morning?
Nothing, Mr. Chairman. Thank you.
All right. All right. I do want to add a few things this morning. Commissioner Jung and I did get the opportunity last week to go visit the air races, and I want to congratulate them, Mr. Legatera and all of the staff and volunteers that participate at the Reno State Airport. It was a phenomenal event. Once again, another great legacy event we have here in Northern Nevada that does support community. And truly felt like, again, once like Commissioner Jung said, a sense of community was definitely apparent there. And it was great to support veterans. It was great to support our active military. It was great to support our first responders and all those individuals that were out there. And we saw Boy Scouts and families alike all enjoying the spectacle, from the air races and the aircraft to the displays by our military. It was tremendous to see that. And then, you know, it's a wonderful thing, and many people don't understand it, but it's also an opportunity for Reno to showcase places for economic development and the growth that we're experiencing in those northern parts of our valley, and how that's, you know, from residential to commercial growth out there. But Commissioner Jung and I had the opportunity to sit with executives from Delta Airlines, Southwest, and a new airline carrier, AHA Airlines, to continue to elevate Reno's position, Reno Sparks and Washoe County, to hopefully continue to grow our air service. And not only through tourism, but for our commercial and business sector. That is the key to our economic development, is making sure people can get in and out of the community. So I want to thank the air races for their continued event, but the Reno Tahoe Airport Authority for continuing to participate, and all the vendors out there. It was a phenomenal event. We got to spend some time with some individuals out there, which was great. It was a long week last week, so I got a little under the weather and didn't get to make to all my events, but what I will ask too is that I was supposed to attend the National Recovery Month gala dinner on Saturday night, and could not make that dinner, amongst other couple of events I was supposed to go to. So I have a proclamation for them, but I'd like to bring that back next meeting, because I couldn't get it on the agenda in time, and read that and present that to those individuals since I was unable to attend. So I'd like to put that on the agenda. To Commissioner Herman's comments, I'd like to also look at, the county has the ability through NRS to employ a county health officer, not a health district officer, very different, but to help us manage health issues, health-related issues. So I'd like to look at that with the manager to discuss that. That is allowable under NRS to do so. And so if we can look into that, I'd like to approach that and maybe look at some viable solutions for the county going forward for those areas outside of the health district's range in the Truckee Meadows that could provide health assistance for all matters of public health. Another thing I'd like to look into as well, Mr. Manager, is the discussions from Miss Patricia Artis, who has spoken public comment this morning at the Monai Village. I think hopefully I saw one of our staff members grab Miss Artis on the way out and get some information, but I'd like to continue that conversation because that transition for aged out teens that are experiencing homelessness and challenges, that is a huge transition, and we lose a lot of individuals that can be a pivotal point in those individuals' lives, so I'd like to see that come back. You know, it's beautiful, you know, fall weather out there, and people are getting prepared for, you know, we've got school back in full swing and kids out there, but I want to remind everybody, please drive safe when you're driving around school zones. I know people are rushing around and are trying to get back to busy, regular, standard lives, but it's important that our kids are in sidewalks and crosswalks, and we have to be cognizant. We've got new drivers on the road. Please be aware. This is throughout our community. There's a lot of speeding and we've had a lot of fatalities here in Washoe County, undue. And so please be aware of that, and especially with the weather changing and a number of different things, you're gonna see different things going further. So those are all of my comments for today. I do appreciate all my commissioners. We had a wonderful week, and we look forward. We're gonna have our national state conference for the Association of Counties next week. So we're gonna be out visiting our community in Churchill to discuss some of those issues. And then what's happening across the state. And then another thing I'd like to talk about, Mr. Manager, too, is I had a good meeting with the BLM yesterday. We did have public comment from our partners in Story County in regards to issues along the East Truckee Corridor. However, BLM does not own a lot of that land, and that is owned by the Nature Conservancy. So I want to talk to how we can work with the Nature Conservancy and identify some plans in there. And then the wild horse issue. We definitely need to address the wild horse issue. We had 2 horses killed on Friday night by drivers at about 9:30 p.m. To not impaired drivers. It's just an issue that we have wild horses in our community, and at night, they, as Commissioner Herman will attest to, animals can walk out into the road. You can't see them until you're right on top of them. And so, unfortunately, it is a nasty issue, but it does impact all of the homes along the Virginia range, and so I'd like to look into that as well. So those are the issues that I would like to look into, and that's all I have. Anything else for any of the commissioners?
I do, Mr. Chairman.
Commissioner John.
I have been receiving, I don't know if the rest of you have, but I have noticed just driving around as well, complaints about all the rubbish and trash on our streets. And specifically, a complaint I have been dealing with is Clear Acre and Lane and Sun Valley Boulevard. And I'm not sure if the sheriff's work crews aren't doing work because of COVID. I also know every industry is experiencing staffing issues, but I do need some help from staff on how we are going to address that, not just the littering, but another issue that, much like Lockwood and the Story County representatives came and complained about, there are also many displaced homeless arriving in Sun Valley. And I know that displacement is not in our plans, and so I need an update or some help with what are the next steps when people are displaced from the downtown core and find a new favorite place to park? And what are we going to do for people that actually do have shelter, i.e. a vehicle or a trailer, that sort of thing? where and when will we be providing a place for them to go that is safe and not having them being chased across this valley? So I know I'm not the only one experiencing it. So just like the littering, it must be countywide. So it'd be great if we could get a staff plan, or where do they need resources from to even just clean up this valley? I had complained before about the entry coming from west from California into Nevada and into our county, and then eventually into the city of Reno, and that also is not looking so great. And I'm wondering where NDOT is with their work crews as well. I probably can answer the question, but then which is staffing shortage, but then I need to know the plan B, C, and D, especially with this ARPA money. Thank you, Mr. Chairman.
All right. Thank you, Commissioner John. Commissioner Herman.
Thank you, Mr. Chair. In regards to the wild horse issue that you're speaking of, it would be in your area, is that correct?
That's correct.
BLM is not responsible for those horses in particular.
Right.
It's got to be handled by the county or something different. Maybe wildlife could help.
Right.
But it is not a BLM.
Yeah, that's not a BLM issue. I know that.
Right, okay, just wanted
Yeah,
to save you
and
some time.
Yeah, thank you. I know I do, and I know a lot of those along the Virginia range. That's mostly Department of Agriculture and the state and us, and also Story County to address those issues. But we do need to find some sort of a plan with the preservation groups and to make sure that we're doing it effectively. To provide for that protection, and that's one of the things we want to do.
As with the BLM horses, drift fences are
Right.
usually the most effective.
Yep.
And make fines if people cut the fence,
Yes, absolutely.
because that causes death.
Well, and it's and one of the other things that we've found is that that individuals, it is for those just to update those, it's illegal for individuals to feed the wild horses.
Or
We have a
water.
number of individuals that feed the wild horses close to the communities, thus bringing them in and giving them a false sense of understanding for food, creating a larger problem. So those are the other things we need to address, that we can work with the sheriff's office, CSD, and a number of groups but we do need to identify some sort of plan. So I'd like to work on that with staff and identify a proactive plan to address it all along the Virginia range, at least for District 2 specifically. So, seeing nothing further, I do want to add one last little diatribe this morning while I have a little bit of an audience this morning. Our last meeting, we have a number of public comment from individuals that came and represented themselves as in individual forms, historical figures. And I want to take a minute to defend staff. Our job is very difficult to provide the data, but it is the data we have. Information can be perceived however you want to perceive information, whether it's a vaccine, a test, COVID, it doesn't matter. There is a short theory about individuals who believe the earth is flat. You know, they'll sit there and they'll tell you all day long the earth is flat. However, most of us, perceive the earth to be round. I could hold up a piece of green paper, and for those that are colorblind, we'll see a gray piece of paper where all of us will say green. There's a difference in what we can see and how we perceive things. Now, for those individuals who think the vaccine is safe and fair and what should be done, that's their perception, and that's what they should be allowed to believe, and no one should judge them based upon what they believe or what their perception is. For those of you who don't believe in the vaccine, your perception is just as equally valid. However, to continue to be divisive and fight each other and create animosity and divisiveness between each other is not beneficial to anyone. And it's frustrating for us to sit here and say that one person is right and another person is wrong. We try to provide the data based upon what we get from our hospitals, from our public health officials, from our community, and when the data is what the data is. So you can choose to do whatever those are your rights as a United States citizen. You can choose to. However, we're going to continue to provide you the data to the best of your ability to protect yourself. And if you And if you can't align with that, that's fine. But to continue to beat up on each other and use these platforms as a way to toxify or hurt somebody else, it does not help. So I would ask continually that for those that are in the audience and those that are watching online, that this is a format for growth and continue to move forward and move our county forward so that we can be better in the future, not worse. There's too much of negativity in our community these days. So that's my opportunity, using this as my platform, to ask for a little bit of kindness and hope and forgiveness going forward. So please be cognizant of that when you utilize that podium or any microphone from that standpoint to provide your opinion. So, all right, and just to say, all opinions are welcomed here. We're not going to shut out any one opinion. We're going to welcome all, but we just make sure that they're being positive and uplifting. All right, with that being said, I'm going to close Commissioners and County Managers' announcements, item 6. We're on to item 7. Mr. Manager, this is a presentation.
Item 7 is a presentation by Kelly Echeverria, Washoe County Emergency Manager, on the Emergency Management Accreditation Program, EMAP, and acceptance of a plaque in recognition of EMAP accreditation. And she is in chambers with us this morning.
Ms. Echeverria, it's so nice to see you. Thank you for coming and being here with us this morning.
Good morning. Thank you for having me. I'm happy to present to you today our emergency management accreditation. I'm going to talk you through a little bit of what that meant for us as a program in a region and how we're doing today with it. So I'm just going to go over the overview of the accreditation program, the benefits that it brings to our program in the region, the standards that we were held to, how we applied those standards, and again, what we're seeing today. So this is a voluntary program. It's a process of self-assessment and external independent peer review. We had assessors in the emergency management field from across the country, and including one from Canada. They were evaluating our program's organization, resources, plans, processes, and capabilities against the emergency management standard to increase the effectiveness of our program in protecting the lives and property of the people that we serve. So the peers assess the degree to which our program achieves compliance with the emergency management standard, which was actually 64 individual standards broken up into multiple pieces each. If you can imagine how lawyers break apart NRS into specific words and what that means, similar situation with standards. The accreditation process provided a mechanism for critical, objective, and constructive review. It was rigorous, but it is the industry standard for emergency management programs. It continues to evolve to represent the best practices in emergency management and is expected to continue improving and advancing the state of the profession as a whole. The standards are updated every 3 years. So to give you some perspective, our last accreditation was in 2015, based on the 2013 standard. It was updated again in 2016, and then again in 2019, but it was not released until 2020, which is when we did our reaccreditation. So it was quite a close turnaround for our program, and as you know, it occurred during a pandemic. So a little harder than we originally had planned. But EMAP standard defines what a high-quality emergency management program is, rather than how any particular function of the program is conducted. So how do we apply it? First, we should talk about what an emergency management program is, and EMAP defines that as a system that provides for the disaster cycle, so preparedness, response, recovery, mitigation, prevention, across all hazards. And as you know, in our region, we have 13 identified hazards. Internal and external stakeholders must be involved in the accreditation process. They are who make our program what it is today. We can't respond as emergency managers without the whole of community being involved. Emergency management program determines how we'll comply with the standard And what that means is basically, what do we say that we'll do? How do we say that we'll do it? And where is the proof to show that that's actually happening? This is evident in our committees, administrative and fiscal policies, laws, authorities, risk assessments, mitigation, resource management, just to name a few. So these standards are recognized by the International Association of Emergency Managers, by NACO, and by the National Emergency Management Association, or NEMA. So what are the benefits? What are we getting out of this deal? Whoops. I like to say street cred. But really, the work and effort invested in the process helps us better serve our community, and in turn, that builds trust with the citizens that we serve. Accountability. So we come to the board and we give you all of our plans, about 90 plans that you approve, and then what happens? The plans include a timeline for training and review, and EMAP holds us accountable for doing what we said we would do in the manner and time frame approved by the board. Sustainability. So the documentation and improvement processes have assisted us in the sustainment of our program's capabilities through turnover and changes in leadership, which we saw earlier this year. We've improved coordination and relationships with stakeholders whose combined efforts help to establish a holistic emergency management program and have increased stakeholder ownership, morale, and pride in our program. It's my experience that this is evident throughout the state and the country. In meeting with fellow emergency managers and talking about best practices from our region, it is an industry, it's rare that communities come together in the way that ours does. Put politics aside, put our crest aside, and respond together for the benefit of our citizens. We are now better positioned to respond more efficiently and effectively, which helps us build resilience. So the identification and resolution of gaps throughout this process of accreditation has led us to greater long-term resilience. An example of this would be how we found that coordinated regional mitigation is our biggest area for growth and investment. We passed that standard, but we could do better in improving resilience and being creative with how we do it. As they say, every dollar spent on mitigation is 11 saved post-disaster, which just brings us to cost savings. So identifying those ways that we could be more efficient. So the juicy details. Who is EMAP accredited? You'll see this map. So in Nevada, we were the first to become EMAP accredited, followed by the city of Henderson, and finally by the state of Nevada, DEM. We are the only entity to have re-accreditation, so consecutive accreditation. But wait, it gets better. So out of 3,006 counties in the country, only 43 of them are accredited. And of those 43, less than half, actually 17 counties, have consecutive accreditations, and we are one of them. So what level of effort does the EMAP accreditation require? Pre-planning. Lucky for us, we're emergency managers, and that's what we do. Self-assessment and review of those 64 standards. Pre-assessment, enormous coordination throughout the region and the state. Staff time, documentation, documentation, documentation. I could say it like 10 more times and it wouldn't be enough. The actual assessment and teamwork. My predecessor, Dr. Keniston, is a big part of why we were able to achieve this recognition. And those who have come in our program before myself, my team, Jessica Adams and Megan Sullivan, and everyone else throughout the county and the region who helped us get to where we are. This award is for them as well. So I thank you. That's our team up there. And it's less fancy, it's just black, but I have this plaque to present to you for the emergency management accreditation of the Washoe County Emergency Management Homeland Security Program.
Marvelous. Ms. Echeverria, congratulations. All right, let's take one last picture today. All right. There you go, and we'll do two more. There, and there, very good. Congratulations, ladies. Thank you. All right, so this is for possible action this morning. So Madam Clerk, is there any public comment signed in on this item?
There's nobody signed in.
All right, see no public comment. This is the acceptance of the recognition, so I'm looking for a motion to move for the acceptance.
Move to approve.
Move to approve. I got a motion. Do I have a second? I have a second from, motion from Commissioner Hill, second from Commissioner Herman. Call for the vote. All those in favor signify by saying aye.
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 All those opposed? Motion carries unanimously. All right, we are on to item 8A1. Mr. Manager.
These are proclamations, Mr. Chair. The first is 8A1 is a proclamation proclaims September 28th, 2021 as National Voter Registration Day.
Good
And
morning,
accepting
lady.
will be, I'm sorry, Deanna Spicula,
Oh, yeah.
our registrar of voters.
Our
and she's
registrar
very
of voters. Spicula. Nice to have you joining us this morning. Good morning, ladies and gentlemen. It is my honor to stand in front of you today and read this proclamation. As we talk about voter registration here in the county, it is one of the most important honors and civil rights of all of our community. And it is challenged almost daily, but it needs to continue to educate individuals and continue to bring forth the ability for our civil democracy to continue to elect individuals, continue to put leadership in place so that we have a civilized and secure and lawful society. And so it's with great honor that I get the opportunity to read this proclamation for you this morning. Whereas one of the most precious and fundamental rights of the United States citizens is the right to vote. And whereas registering to vote empowers eligible citizens to exercise their right to vote, and they have a voice in the electoral process promoting civic engagement. And whereas Washoe County has over 275,000 registered voters, which continues to increase in our community as our community grows. Whereas the voter registration process in Nevada and in Washoe County is now easier and more convenient than ever, with registration available through in-person registration at the Office of the Registrar of Voters, mail-in applications available at local libraries and post offices, a state voter registration agencies, and through online voter registration available at www.registertovotenv.gov. And whereas September has been proclaimed National Voter Registration Month, and whereas Americans across the nation have celebrated National Voter Registration Day on the fourth Tuesday in September, serving as a single day where we reaffirm the strong sense of civic pride and encourage our fellow citizens to register to vote. Now, therefore, the Washoe County Board of Commissioners does hereby proclaim September 28th, 2021, as National Voter Registration Day, signed by myself, Bob Lucy, Chair. With that, Ms. Spicula, the floor is yours, ma'am.
All right. Thank you, Chairman. I just wanted to update the number. So when this was drafted a while ago, our voter registration numbers were a little bit lower. We are now over 320,000 registered voters.
Wow.
So I think it's just important to let you know that the registration process, as our community grows, our registration numbers are going up. And it, as Chairman said, it is such an important part of the process for enfranchisement of our citizens and allowing them access to our electoral process. So thank you very much. All right, thank you.
Okay. Item 8A2 is a proclamation to proclaim the month of September as National Hunger Action Month. And accepting will be Shane
Piccinini.
Can you say that for me?
Piccinini.
Piccinini. Thank
Shane
you.
Piccinini's down here.
From the Food Bank of Northern Nevada, and I just met Shane recently. He gave me a fabulous tour of the food bank.
Mr. Piccinini is a wonderful man, and he does a lot of great work out of the Food Bank of Northern Nevada. It's always great to see you, Mr. Piccinini.
Thank you. It's good
All
to
right.
be here.
Yes, and I also had a chance to tour the food bank recently, and they are doing amazing new programs for seniors, a basket program so that seniors get out of their houses and socialize and pick up food. And I know that they're looking at more additional services in Sun Valley as well. So very excited and honored to present this proclamation. Whereas hunger and poverty are serious issues in the United States, the state of Nevada, and Washoe County. And whereas food insecurity and lack of access to healthy foods contribute to the development of various nutrition-related illnesses, and children facing hunger are more likely to experience developmental delay, need to repeat school years, and even experience more social and behavioral issues. Whereas in 2020, the Food Bank of Northern Nevada, with the help of our partner agencies, distributed more than 7.4 million pounds of food to assist more than 700,000 individuals and families. And whereas the child food insecurity rate in Washoe County reached 14.4% in 2020, and whereas increased healthy food access and security in Washoe County enables residents of all ages, ethnicities, and cultures to lead happier, more productive, and more active lives, helps children to develop their fullest potential, and supports a thriving local economy. And whereas the Washoe County Commission desires to build towards a future where no child need go hungry, and where all Americans have access to healthy, affordable, fresh, locally made, and sustainably produced food. Whereas the Washoe County Commission enjoys a collaborative partnership with the Food Bank of Northern Nevada, which is focused on expanding access to healthy foods for residents of all ages, abilities, cultural, and economic backgrounds. Now, therefore, the Washoe County Board of Commissioners does hereby proclaim September as National Hunger Action Month, and commits to continue the work with the Food Bank of Northern Nevada to make policy and system changes that will improve food access more equitably throughout the neighborhoods we serve, prevent hunger, and promote the well-being of all residents in Washoe County, signed by our chairman, Bob Lucy. And I'll let you say a few words, Shane.
I just want to, Shane Piccinini for the record, Food Bank of Northern Nevada. I just want to put on the record our heartfelt thank you for all of the support that we have received from this commission over the 30 years that the food bank has been operating in Northern Nevada, but most specifically, the support that we have gotten over the last 18 or 20 months or however long it's been in, without a doubt, one of the most stressful situations. We're still currently serving over 100,000 individuals every single month. We don't see this need going down as economy recovers, just like it was with the Great Recession and the housing crisis that has been compounding these issues. I think it's going to be a while before we're able to dig our community out of this hole. And I just know for a fact that because of your support, we literally have been able to save people's lives by granting them access to food over this period of time that I hope we never, ever, ever, ever repeat again, ever. And so, yeah, thank you so very much.
Thank you, Mr. Piccinini, and all the work that you guys do at the food bank. It's tremendous. I don't think people realize that even in our beautiful metro area of northern Nevada, and there are still places within our community that are considered food deserts, and that people have tough times accessing good, healthy food. Those that are disabled, those that are senior citizens, and the amount of work that you do is phenomenal. So thank you for your continued support and for our community, all the work that you do. So
Thank you.
great. Big round of applause. So what I would ask is if you, Mr. Piccinini, if you'll stay around, we'll take a picture really quick with both that and our registrar. So if we could step down here.
One, two, and three. And then one more. One, two, and three. Okay. Awesome. Great. Good to see you.
All right, registrar, got it. Okay, so that completes our proclamation. So at this time, I am looking for a motion to accept both proclamations. I have a motion from Commissioner Herman. Do I have a second?
Second.
Second from Commissioner Hill. Is there any public comment on either of these items, Madam Clerk?
There is no public comment.
Seeing no public comment, we will close public comment. I have a motion and a second. All those in favor signify by saying aye.
Aye.
Aye. All those opposed, motion carries unanimously. All commissioners voting. All right, Commissioner Hill, will you take us through our donations today?
Yes, I will. I know I will not do it as well as Commissioner Jung does, but and this isn't a form of a motion, would like to recognize and accept the donations of $11,664.05 and in-kind donations, estimated value of $174,565 from various businesses, organizations, and individuals for regional parks and open space programs and facilities, and direct the Comptroller's Office to make the appropriate budget amendments. And I move to accept donations of $285.35 from the United Way of Northern Nevada and the Sierra to the Washoe County Sheriff's Office for the Victim Advocacy Program, and if approved, authorize the Comptroller's Office to make the appropriate budget amendments. And these budgets are really affected by the community giving us their time and treasure, and we really appreciate it. So thank you so much, and thank you, Mr. Chairman.
All right. So I have a motion. Do I have a second to accept the donations? I have a second from Commissioner Herman. Do I have any public comment on any of the donations?
There's nobody signed in.
All right, seeing no public comment, we will close public comment. I'll call for the vote. All those in favor signify by saying aye.
Aye.
Aye. All those opposed, motion carries unanimously. We are on to item 10. This is our consent agenda. We have consent agenda items 10A1 through 10D1. Is there any items that we would like to take out of the consent agenda or have anything further from any of the commissioners?
Mr. Chairman.
Commissioner Vice Chair Hartung.
Thank you. I just wanted to note that item 10B1, and I'm fully supportive of this and leaving it in consent, but there was commentary by Judge Tyrus posted on Incline Village Crystal Bay Community First about the court. And I'd also like to note that, one, it is in consent. It's not even a standalone agenda item. And the court was closed for, it appears that the Incline Village Justice Court was closed for over a year and only recently partially opened. And yet we didn't get a single email regarding lack of physical access to the court. So I'm vexed. But again, I am supportive. Thank you.
Thank you, Commissioner. I do appreciate that comment. Any other comments from any of the commissioners in regards to this? All right, seeing nothing further, I will look for a motion to approve the consent agenda as posted.
Mr. Chairman, I do have public comment.
I will get to it in just a second. I have a motion from Commissioner Herman. Do I have a second?
Second.
Second from Commissioner Hill. I'll call for public comment on the items.
Thank you. I received 31 emails on item 10B1. Would you like the names?
Yes, please. You can please read the names into the record.
Emails are from Heather Williams, Helene Larson, Rhonda Ticer, Lynn Carroll, Doug Flaherty, Mary Lou Kennedy, Aaron Vanderpool, Gail Krolik, James Lyon, Alan and Ellen Castator, Jill Mulcahy, Myra Hanish, Alan O'Connor, Steve Tomkovitz, Jennifer Noble, Lane McAvoy, Alan and Pamela Signos, Richard Miner, Pam Fernandez, Ned D. Antios, Helen Hagan, Svata Trossen, Stan Harrisberg and Diane Becker, Jean Zambic, Miles Reiner, Kern Shoemaker, Michelle Koch, Diane Schmenk, Craig Olson, and Gary Stewart, and these will be placed on the record.
Great, thank you, Madam Clerk. Seeing no further public comment for anybody in the chambers, we'll close public comment. We have a motion and a second. All those in favor signify by saying aye.
Aye.
Aye. Aye. All those opposed? Motion carries unanimously. Will all commissioners please affirm your votes on the screen. Mr. Manager, that takes us actually to our normal business, and I am going to look to Commissioner Hill. Do you have a block vote this morning?
Yes, Mr. Chairman, I have a block vote. I'd like to see item 11 and 12 in a block vote,
All right.
and that's in the form of a motion.
All right. I have a motion. Do I have a second? I have a second. Mr. Manager, will you please read these items into the record?
Item 11 is a recommendation to approve reclassification of an administrative secretary pay grade J to administrative assistant 1 pay grade K, comptroller, reclassification of a public administrator estate investigator pay grade L to the new classification of lead public administrator estate investigator pay grade M, and create one new full-time public administrator estate investigator position, pay grade L, in the public administrator office. Reclassification of a program assistant, pay grade K, to program coordinator, pay grade L, and a program assistant, pay grade K, to management analyst, pay grade N, Human Resources Agency. Reclassification of an animal services assistant, pay grade L, to office assistant 2, pay grade L, in animal services. Reclassification of a family court investigative specialist, pay grade L, to family court investigative specialist 2, pay grade N, public defender. Reclassification of an office support specialist, pay grade H, to media production specialist, pay grade J, in the sheriff's office. Reclassification of an account clerk 2, pay grade H, to office support specialist, pay grade H, in the libraries. Reclassification of a deputy county recorder, pay grade G, to office assistant 2, pay grade E, in the recorder's office. Reclassification of a technology services developer 2, pay grade NO, to technology project coordinator, pay grade QR, technology services. Create one new intermittent hourly investigative assistant position, pay grade I, one new intermittent hourly DAS case manager position, pay grade I, J, alternative sentencing as evaluated by the Job Evaluation Committee, create one full-time position as new classification community reinvestment manager, pay grade Q, and create one full-time position as new classification grants and community program analyst, pay grade N, the manager's office, as reviewed and evaluated by Korn Ferry and authorize Human Resources to make the necessary changes. Okay, total fiscal impact, $540,016. Net fiscal impact, $113,736. Item 12 is a recommendation to approve the interlocal agreement between Washoe County and on behalf of Washoe County Sheriff's Office and the City of Reno on behalf of the Reno Police Department for forensic laboratory analysis service performed by the Sheriff's Forensic Science Division. Fees for the retroactive term, July 1st, 2021 to June 30th, 2022, with a total income of $1 million.
All right. Madam Clerk, do I have any public comment on either of these items?
Nobody has signed in on either.
Okay, seeing no public comment on items. Any further discussion by any of the commissioners? Seeing none, call for the vote. All those in favor signify by saying aye.
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 All those opposed? Motion carries unanimously with all commissioners voting. All right, that concludes our business for today. Ladies and gentlemen, thank you all for coming. Mr. Manager, that takes us to item 13. This is our final public comment.
Item 13 is public comment. Comment heard under this item will be limited to 3 minutes per person and may pertain to matters both on and off the commission agenda. The commission will also hear public comment during individual action items with comment limited to 3 minutes per person. Comments that are made to the commission as a whole.
All right. Madam Clerk, will you please call public comment, please?
We have Alan Tyrus signed in.
Good morning, Mr. Chairman, members of the commission, those here and present and also away, Mr. Manager. I am Alan Tyrus. I'm the Justice of the Peace at Incline Justice Court. I do appreciate the fact that the lease extension was approved as a part of the consent calendar here today. I do thank you for that. One of the things that I do want to respond to, however, is Commissioner Hartong's comment regarding our court being closed. Our court was never closed. Our court was not open to the public, but from March on, we were open virtually. We never closed. We never lost a session. In fact, to this day, we are totally caught up with our calendar as a result of the efforts of my team, my staff, the district attorney, the public defender, defense counsel throughout the county, and the public. So I do take exception to Commissioner's comment that the court was closed for a year. We were never closed. And I thought it was a very important, it is an important point to make to this commission for clarification purposes. Thank you very much.
Thank you.
I have nobody else signed in.
All right, seeing no further public comment, we'll close public comment, bring it back to the board. We are on to item 14, final commissioners and county managers announcements. Mr. Manager, do you have anything final?
Mr. Chair, if you'll indulge me for
Please.
a second, I forgot to read. I thought it might be helpful to this board if the manager could give you a weekly or an update on the census at the shelters. Perfect. So I brought that. I meant to share it earlier, and I did not. This is as of yesterday, as of Monday, September 20th. At the Nevada Cares campus, which, as you know, is the men's campus, capacity is 604. We're actually seeing on a daily basis that we're either full or at most about 30 available beds. So it's at pretty much full capacity at this point. The campus has been secured as of last Friday. Prior to Friday, we were having issues with, there was no fencing to distinguish who was on the campus and who was visiting, and was creating some security issues, so that's been addressed. I will tell you that at all of our shelters, staffing is a big issue. We are working to try to get VOA fully staffed and have the requisite number of case managers and other folks to attend to the guests. We did have some positive cases at the men's campus. Those folks are in isolation and testing is underway. And then housing is a challenge at all of our shelters in terms of finding permanent housing for folks once they are ready to transition. The Safe Camp, likewise, capacity is 45, it's full. We are happy to report that there have been 7 successful placements into housing since we've opened the Safe Camp. I think that's important to note. Carmen Box, I think, is doing a great job. We currently have 15 ready to go to housing, but we've not been able to identify a housing option for them. So, as far as our place, capacity is 138. We have about 2 open beds on any given day. And again, we have clients there ready to transition, but a lack of affordable housing for them to transition to. So if the commission finds this helpful, I'll make sure that in future meetings, in the opening comments, I can share the latest information. That's all I have, Mr. Chair.
Hey, thank you. Commissioners, anything further?
Mr. Chairman.
Commissioner Hartung.
Thank you. Thank you. I would like to reiterate what I said and what I put on the record, that not a single email regarding lack of physical access to the court. Thank you, Mr. Chairman.
Thank you. All right. One last thing I would like to point out too, that I've had some discussions that I forgot to add this morning in my discussions, were 911 calls. Over the past few weeks, obviously with the Delta variant, a number of individuals throughout our community, whether feeling sick or not, have been utilizing 911 to an extent that it is overwhelming our system. Both REMSA and our hospitals are feeling the pressure of 911 calls to the hospitals because of the level of individuals not being able to get tests or the accessibility, and it's causing issues for those that are truly experiencing true emergency medical issues, whether that's cardiovascular, orthopedic, truly telemetry, diabetic. So what I would urge those individuals, one, the vaccine is still available. If you can get the vaccine and feel comfortable with getting the vaccine, please do. If you do feel symptoms and you're not overwhelmed with a place of you don't feel good, please stay home. Try to nurse yourself to the best of your ability. Call your general physician or a clinic. But to overwhelm our emergency rooms is going to be quite trying, because there are individuals. The manager and I did tour the regional transfer operations center for Renown, which utilizes that. Renown, it represents about 60% of our healthcare in our region. And when you talk, and they have and let me tell you, it looks like a command center. And it truly is one. Screens everywhere, but they are monitoring patients at every level and throughout their hospitals and all of their campuses across northern Nevada, and to identify and realize that our hospitals are not just hospitals for Reno and Sparks, but they are triage centers for other hospitals in Churchill County, Pershing County, Winnemucca, a number of those hospitals. So if we do not have the beds and accessibility for those patients, it makes it very difficult. So please understand, I understand COVID is challenging. I understand that this is a trying time, but please be cognizant of utilizing 911 only when truly necessary and the situation is truly emergent. That is really what we're trying to accomplish here. Remember, we want to maintain our hospital levels. so that we can properly and adequately treat everybody. But if we're just calling and going to the ER just because we're starting to feel sick or we think we need a COVID test, we're doing the hospitals and our community a disservice. So please be cognizant of that. All right, I have nothing further. If there's nothing further from anybody else, I will close the meeting and we will be adjourned. Thank you very much, everybody. Have a great day.